I'd like to call to order the Health and Human Services and Aging Committee today, Wednesday, October 1st. Woo-hoo. And it's a little after 1 o'clock. Madam Clerk, can I have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney. Mr. Sweeney is absent. Mr. Castleberry.
Here.
Mr. Hauser.
Here.
Mr. Schlepper.
Here.
You have a quorum.
All right, I'd like to, even though we're not required, I'd like to make a motion for the absence of Councilman Sweeney. Is there a second?
Second.
Moved by Conwell, seconded by Castleberry. All in favor, please say aye. Aye. Madam Clerk, is anyone signed in for public comment this morning?
Yes, Madam Chair. Ebony Spano.
Good afternoon, County Council. My name is Ebony Spano. I'm a mother and the Executive Director of Grow and Move, Mamas Organizing Voter Economics. I'm here today, as I've been before you many times, in regards to the County Board of Developmental Disabilities, where their funding is going and where their training is going. Today, I see they're here to give public comment. I wanted to get a public audit of every waiver, including the IO and the self-waiver, and a racial zip code breakdown of the recipients for all of those who are on this waiver and their age groups. And I want to know a written education plan for the SSAs. Are they informing families that they are doing an assessment? Because I was not told I did an assessment back in November of 2021, even though my son was denied. So we need to rectify that, not just for me, but for other families. Thank you.
And Madam Chair, that concludes our public comment.
All right, thank you. We have before us now approval of the minutes from the September 17th, 2025 meeting. Can I have a motion?
So moved. Second.
Moved by Schlepper, seconded by Castleberry. All in favor, please say aye. Aye. All right, there was no legislation referred to this committee, but we do have a presentation by the Cuyahoga County Developmental Disability Services, Medicaid, in regards to Medicaid home and community-based waivers and planning. This was something that we heard at a council meeting, a request from some constituents at a council meeting in regards to the IO and self-waivers. So we are glad to have in our company today Amber Gibbs, CEO and President of Board of Developmental Disabilities. Thank you.
Good afternoon. Thank you for having me. I'm really happy to be here today to talk about the services that we provide at the county board, one of which is Medicaid waiver services. So just a little overview, because some of you may be new to County Board of DD Services, a little bit about what we do. We support and empower people with developmental disabilities to live, learn, work, and play in the community. And that is our mission statement, one that I love because it's simple and clear, and it's easy for us to remember in terms of what guides our decisions throughout the work that we do every day. So we serve people throughout the lifespan, from infants, ages 0 to 3, who are struggling to meet their developmental milestones through our early intervention program. We support children who are in school who might be struggling in their public school district. We go in and provide technical assistance and support. We help match high school students to life after high school in terms of jobs or day programs. Our employment services, we provide not only matching jobs to individuals with disabilities, but we have a business development department where we go to companies throughout the county and find needs that they have and then help match individuals to those employment needs. We have a family supports program, which is a very robust program. It supports almost 6,000 people a year. That is a small monetary allowance that families who are providing care for a loved one with a developmental disability receive each year. They can use those funds for things like equipment or camp or respite, whatever they need to support them having a person with a disability in their homes. We provide housing opportunities and many other services throughout the lifespan. Because I only have a short amount of time today, I can't even go through all the things that we provide, but I wanted to give you a nice overview. So who do we serve? We serve 15,000 people a year throughout the lifespan, as I said. This number has grown significantly over the last 10 years. In order to be eligible for county board services, you must meet the criteria that are outlined in the Ohio Administrative Code. You must have a developmental disability that presents itself before the age of 22. That's the developmental period in Ohio. You have to also have substantial functional limitations in areas like self-care, learning, mobility, or self-direction. So someone could technically have a developmental disability diagnosis, but not be eligible for county board services because they don't have any limitations in those functional life areas. So it's a two-pronged eligibility test. Your developmental disability cannot solely be the cause of a mental illness or your functional life limitations, and your disability must be expected to last a lifetime. We also know that people do grow and change throughout their lives. They learn new skills and abilities, and so sometimes we reassess eligibility throughout someone's lifespan to be certain that they still meet that substantial functional limitation prong of the eligibility test. Who we serve. On the left there, you can see the breakdown of individuals that are served by Cuyahoga DD, and on the right is the 2020 census information for Cuyahoga County in general. I'm very proud of this data because we started collecting this a little less than 10 years ago. This was not something we were required to collect by the state of Ohio, but we began collecting this data because we wanted to make sure that our services were equitable and reaching people throughout the entire county. So you can see here that we actually serve a more diverse group of people than is evident in the entire county population. Our breakdown is 46% individuals we serve identify as white, 38% Black or African American, 2% Asian, 2% some other race, and 6% two or more races. You will note that that does not add up to 100% because some people choose not to disclose their identifying information, and we don't guess if you don't want to share that with us. We also serve about 9% of the individuals we serve identify as Hispanic or Latino heritage, which is also higher than the county average. Over the last several years, we have been very proactive in identifying which zip codes throughout the county do not seem to have a population that we would expect based on the incidence of developmental disabilities. And so we have reached out to those communities through daycares, preschools, physicians, and through targeted mailings to individuals in those zip codes to make sure that they know that we are here and able to serve them. You can see at the bottom, we serve many more males than females. And we serve about 50% of the individuals that are open to our services are under the age of 22, so they're considered children to us, and 43% are adults. I'd like to talk about waivers because they get a lot of attention. People always hear about waivers and are curious what they are. Medicaid home and community-based waivers are just one way that a county board of developmental disability meets the needs of the individuals we serve. Waivers by law and as established through Medicaid allow individuals to receive the supports that they need outside of an institutional setting. It allows people to live in the community, which is why they're called home and community-based services. By accepting a waiver, you are actually waiving your right to live in an institution, to receive institutional care. So the institutional care is the entitlement for people with disabilities. A waiver is not an entitlement, it is an alternate service option. Waiver eligibility is determined by using a standardized needs assessment that has been established by the state of Ohio and is in the Ohio Administrative Code. And there are various criteria that you have to meet to be eligible for a waiver. Some of those examples are things like loss of a caregiver, or serious risk of harm due to medical and behavioral needs, or discharge from an institutional setting. And again, that is established by the state, and all of our support administrators are trained on that and have to take state training in order to administer that assessment. A lot of people, most people that we serve out of our 15,000 have their needs met without a waiver. The Ohio Administrative Code actually requires that county boards look at local opportunities and resources for people to meet their needs before we enroll them on a Medicaid waiver. Medicaid waivers fund medically necessary services and items such as personal care, so someone to come into your home and help you with hygiene and dressing, household tasks, meal preparation, and community access, especially for those people perhaps who are adults and at that point in their developmental age should be able to do those things independently. It can offer transportation to and from work or activities or volunteer opportunities in the community, adult day activities or employment, and home modifications or adaptive equipment to help someone remain in their home and be as independent as possible. A waiver doesn't cover everything. Waivers do not cover anything related to housing costs, so your rent, your utilities, things like clothing or food, those items are not covered under the Medicaid waiver. And anything that can be covered using another payment source. So for example, if you have personal resources available to purchase an item, you are supposed to use those resources before you utilize waiver services. Again, because as we know, federally, Medicaid considers itself the payer of last resort. If you have private health insurance, you're supposed to use your private health insurance first, or if you have another organization that is providing you services. So if you're able to get home health care through your insurance or through Medicaid card services, the expectation is that you have to use those services before accessing your Medicaid waiver dollars. And then lastly, about Medicaid waivers, authorized services are based on your individual assessed needs. So no two people's waiver services will look alike because people generally need very different things depending on what their circumstances are. So sometimes we hear from families, you know, my neighbor has this, or a family that we know has this. And so you might be able to get that if you have similar needs to what that person has and nothing else has worked for you. We may have tried other options for you first. So Medicaid waivers are paid for by a unique combination of federal and local support. About 60% of the cost of every Medicaid waiver is funded by the federal government, with the local obligation of state and county making up about 40%. Those numbers change over time depending on what the federal government is putting in. In periods of time when the economy has been bad, the federal government has kicked in more to help local economies. Other times our percentage is a little bit higher. So here in this graphic, you can see that really by enrolling people on waivers, we draw down a tremendous amount of federal dollars to our community through the waiver program. In fact, last year, we authorized about $473 million in services to people with developmental disabilities. That's services in Cuyahoga County. That equals increased independence for people that we serve. And very importantly, it creates thousands of jobs in Cuyahoga County for all of the people that help the individuals with disabilities. Waiver enrollment is a lifetime commitment to an individual with a developmental disability. And over time, it can cost millions of dollars throughout a person's lifespan. We know looking at average waiver costs per year and multiplying that by the average lifespan, it's at least $1 million. People who have very expensive needs or a lot of high needs, they can cost several $1 million. So that's one of the reasons that in the rule, we don't go right to a waiver to meet every person's needs. Many times, a person might need equipment or short-term services, or they have other resources on which they can rely before we enroll in a waiver. County funding for the local matching portion of Medicaid is mandated in rule. That is our #1 expenditure at the Cuyahoga County Board of DD. It is the one thing that we are required by federal rule to pay first. So even if we reduced all other services, we would still be contributing towards waiver match dollars. One of the things that's been coming up recently, just a side note, in light of the conversations about property taxes throughout the state, many counties are concerned because as a county board, if we can no longer collect money to pay for waiver match, the first place that people will look is to the larger county entity. So that's something that we're really keeping an eye on and making sure that we're advocating for in Columbus. So who do we serve with waivers? Because again, we don't serve all 15,000 people with waivers. We serve around 5,100 people on waivers. And you can see the demographic breakdown here of people served by all of our waiver types. You, I think, have heard information that's a little bit misleading about who is served on waivers, but when you look at our total waiver population, you can see, again, the numbers are higher than the county population itself. 49% are white, 39% identify as Black or African American, 1% as Asian, 3% as some other race, and 2% as 2 or more races. Those that are not identified here have chosen not to share their racial information with us. Current waivers in Cuyahoga County, there are 3 kinds of waivers that have been established by the state that are accessible for people with developmental disabilities. The first is called the Individual Options Waiver. The second waiver is the Level 1 waiver, and the third waiver is the Self Waiver. Here you can see the number of people currently enrolled on those waivers in Cuyahoga County and the average waiver cost per year per person. These waivers are all fairly similar in that they offer many of the same services, homemaker personal care, so that hygiene care, that getting out in the community, the help with taking medications or job or employment services. Those are all offered under all 3 of those waivers. The largest difference right now is that the individual options waiver does not have a hard cost cap. So there are some people throughout the state of Ohio that their annual services cost over $500,000 a year on the IO waiver. The Level 1 and the Self waivers do have cost caps in place, $62,000 for an adult, $41,000 for a child. The waivers also have some differences in the requirements related to those waivers. So for example, the Self waiver, which is our smallest waiver here in Cuyahoga County, when the Self waiver first came into being through Ohio state law, we were one of the first counties that sort of embraced this waiver as an option for many different families. We enrolled quite a few people, and over time, we recognized that that waiver was not meeting people's needs. So many of the people that used to be on Self waivers have since transitioned to a Level 1 or an IO waiver, and part of the reason is because the Self waiver was designed as what's called a self-directed waiver. So it requires people who are enrolled on the self-directed waiver to be able to direct their own services, whether that's by hiring the people that serve them directly or by managing their budget in a much more independent way than the other waivers require. So while it's available, it's not a very popular waiver in our county, and I think we've started to see that throughout the state. Offers almost the same things as the Level 1, but the Level 1 is much easier to navigate for people. We enroll about 105 new waivers every single year. So our waiver match continues to grow every year because more and more people need services from us. And speaking of our growth of waiver match, this slide, I know it's hard to see because it's very small numbers, but the orange colored bar is the number of waivers that we have enrolled over time starting in 2014 to end of year or projected end of year 2025. And you can see that that total here adds up to over 5,000 people, whereas back in 2014, we had, boy, that is a really small number, around 1,400 people on waivers. So we are very active in using the waiver program when it is appropriate for people that we serve. The top line is the amount of money that we spend on waiver match in Cuyahoga County. And you can see in the last 3 to 4 years specifically, that line has sort of gone from a fairly steady cost expenditure line to one that is much steeper in its growth line. And so that's something that we are very cognizant of and we pay close attention to when we talk about long-term fiscal sustainability of the organization. In 2025, our waiver match expenditure is projected to be almost $88 million just for the waiver match portion of our services. Again, that doesn't include any of the services I mentioned to you earlier when I was talking about all of the things that we do. That waiver match is 48% of our overall budget. Again, it's our single largest expenditure. We do have one levy dedicated to Cuyahoga County Board of Developmental Disabilities. This is our primary funding source. It is a 3.9 mil continuous levy that was passed in 2005. Prior to that, we sought approval from voters every 5 years, and in 2004, we approached the county commissioners at the time and agreed that if we could be put on the ballot for a continuing levy, we would make the money last until 2015. And here I am in 2025, being very proud to tell you that we've been very thoughtful with that money. We've made it last for 20 years, despite the extraordinary inflation that we've all experienced in the last 20 years. And to also say, we expect that we will need another revenue source in the next 1 to 2 years to be able to continue to sustain this level of service to the people of Cuyahoga County. For our 2025 budget, again, our waiver match is expected to be 77% of our projected levy revenue. So the most money from our levy goes to waiver match. Those are all the slides that I brought for you today. I'm glad to take questions. I know this was sort of a fast and furious overview, but I wanted to be very respectful of your time and be able to answer specific questions that you may have to make sure that you have accurate information about our agency and our services. Thank you.
Any questions from my colleagues? Councilman Hauser.
I have a few. I appreciate the presentation. I'm looking forward to getting together next week to learn more about the organization. I hear you guys do great work, great work. For me not being fully aware, I was wondering, because of, will the government shutdown affect anything with your organization?
To the councilman through the chair, thank you for the comments. We do not expect an interruption at all in our services. The way that our funding works is that we send money up to the state and providers bill the state directly for the services. And so we know that there is money in the Medicaid budget for several months in advance. So we do not expect any interruption in DD services or billing for the providers that provide those.
That's great.
Thank you.
To the chair, to the director, we've been hearing about waivers. How are the families informed about their eligibility with the waivers, whether it's community-based or whatever the case may be? How are we getting the message out to the families?
Yeah, so we do a lot of direct marketing to families. Again, we also work with physicians, we work with school districts to make sure that they know that the Board of Developmental Disabilities is here. We do not directly market information about waivers because not everyone is entitled to a waiver. So a waiver is only a tool that we use when we've met with the family and done assessments about their needs and we determine that we can't meet their needs with local funding. Because that is the state rule, that's the way that we go first. And then through our conversations with families, if we determine they need more support than what we have or what the community has available to them, then we do have a statewide assessment that we use at that time. And it's very specific. Families receive a copy of that assessment. Once it's completed, they receive due process rights so that if they don't agree with their decision, they can go to a state hearing and explain why they think we made an error in our decisions. So again, we don't market waivers directly because we're not really supposed to, but we do market our services, and waivers are one tool that we use for people.
Okay, I think you might have answered two questions with that response. Can you give me the process for the SSA training? I'm not fully familiar.
Sure. To the councilman through the chair, we have a very robust SSA training program. The state requires a number of training hours for all SSAs. Some of them are done through modules that the Ohio Department of Developmental Disabilities has created, but our onboarding process is several months long. We provide training on local resources, agencies in the community that will support people. We train SSAs on assessments that they have to do, on writing a service plan for individuals. We train them on Medicaid and Medicaid due process. We train them on behavioral health supports and our therapy services that are available. And there is an extensive period of shadowing where they are shadowing a support administrator that does the job currently. And so a lot of times they're sitting in on team planning meetings, on assessments so that they can see them done before they're expected to themselves. And then we also have they start to gradually get a caseload, so only a few people at a time so that they can really understand the job with just a few people before we build their caseloads up very large. And then all SSAs have to do some annual trainings that are required by state rule, and within our agency we have additional trainings. So they get annual trainings, and then every service and support administrator must complete a certain number of continuing professional development units within every 5 years to maintain their certification. It is a position that is certified by the state of Ohio. And so they are very, very involved in the regulatory compliance. We also have compliance reviews where people come in and say, let me see your training records. Let me make sure that all of your employees, not just SSAs, are getting the training that they need, and that we're monitoring their understanding and their competency in these areas.
Excellent, thank you. Last question. For the families, I guess my concern when we do the assessments, is everything in like layman terms so that our family, our parents, our children, they all understand was being given to them?
Yes, that's a great question. So the eligibility tool that we use to determine county board eligibility and the waiver assessment are both state tools. We are not allowed to adapt, we're not allowed to change those tools, but support administrators are trained in how to ask those questions in a way that is understandable. So for example, on the waiting list or on the waiver assessment, it says, you know, describe your need. And so if a family says, well, I need a piece of equipment for my son or daughter to be able to do this thing in our home, we don't just write down what they've told us. We're asking more questions about, well, tell us more about that. What does their daily routine look like? What happens in the morning? Who helps them get up? Who helps them go to school? Who helps them, you know, go to work? And so we're identifying needs as we're talking, and we fill in that information with them. We do have to ask them those specific questions. For example, has this person lost a caregiver, or are they in danger of losing a caregiver in the next 30 days or 12 months? So loss of caregiver is a term that, and it's because it's not always families. Sometimes it's people with disabilities coming to us for help. And so we try to explain what that means, right? The person who helps you every day, is something going to happen to them? Are they moving? Are they going away? Are they not available anymore? And so we do try to put things in simple language. But again, the assessment is based in rule as designed by the state.
Appreciate it. Thank you.
We've been making, if I can just make one more comment, we've made a lot of efforts in the last several years to put most of our information in plain language and in simple language. So even you'll see our annual report is in simple language. It's short sentences, simple words. And we've tried to even come up with tools so that when they get something, for example, from Medicaid, which might be very difficult to understand, it comes along with a letter from us saying, this is what this means.
One more question to
Yeah.
the chair. I also see, you said in the next few years, you guys might need additional funding. Have you guys thought of any ideas of how to, you know, with the county having a deficit, any creative ideas on how to get this funding? Have you guys thought about that yet?
I do not have any creative ideas to share just yet, but yes, it is constantly on my mind. Thank you.
Councilman Schlepper.
Hi there. Thank
Hi.
you for being here today and for this very comprehensive presentation. I just had a couple of questions just to educate myself. You know, my mother actually worked as an in-home care provider for the majority of her career, not in this particular space, but in another county. This is more of a broad financial or fiscal picture, but do you have an idea, I don't need an exact number, but broadly, the cost savings, so for someone to be in an institution as opposed to, you know, receiving a waiver, whichever one they may get, I'm guessing that there is a significant cost savings in doing that for someone to be in their home. Do you have an idea what that might look like?
That's a great question. So I would say 10 years ago, we often quoted numbers saying it cost about $157,000 a year for someone to live in an ICF, an intermediate care facility, which is an institution. And at the time, the average IO waiver cost was around $50,000 a year. So it was a significant cost savings. But if you look at one of my other slides and I tell you what the current IO waiver cost is per year, it's $146,000. So the costs of community care has increased significantly. I think there are a lot of reasons for that. One is that there are more and more people living in the community now that in the past would have stayed in institutions or would have been in state developmental centers. As we've shrunk the number of those developmental centers, those individuals have moved out in the community, and so the costs overall are continuing to rise. I don't have a current number on the cost of institutional care now. I'm actually part of a statewide group that's looking at long-term funding for county boards, and we are seeking that data statewide so that we have a better cost comparison now.
Great, thank you.
You're welcome.
And then also through the chair, what are the requirements for caregivers specifically? So let's say an individual has specific needs, falls under, you know, the categories that they need to be eligible. Let's say a family member is a nurse or an STNA or something like that that could get a particular certification. Is that something that can in fact happen? My guess is that if that person had the credentials as well as, you know, an understanding of what the needs of the person would be, is that something that can be in place?
That's a great question. So all of the certification of providers in the DD system is done through the Ohio Department of Developmental Disabilities. Providers must apply and must attest to certain kinds of training. They have to have a clean background check, a number of requirements. They apply through the department and then they are certified. The department also does provider compliance reviews. That happens within 1 year of certification, and then at least every 3 years after that. That is something that they do in partnership with us. And so an individual is able to choose any what we call qualified and willing provider. And so if an individual requires, for example, very intense behavioral health supports that might include hands-on supports, a provider has to demonstrate that they have that type of training in order for the individual to choose them. When it comes to family members or friends, yes, they are able to become certified through the Ohio Department of Developmental Disabilities, especially and specifically for adults. So just since COVID, the rule has now allowed for parents of minor children to become providers, but only if there is no willing and qualified provider in the county besides the parent. And so that was something that was previously prohibited. Parents could not serve their children. After COVID, that loosened up a little bit. It is something that we see more in the smaller rural counties where there may not be as many providers or as many sophisticated providers. But here in Cuyahoga County, it's very rare that we can't find a qualified and willing provider for someone for a minor child. So it's possible, but it's much more common for adults.
Yeah, and that took me to my third question. I know that there have been incentives at the state level to try to attract people into this particular work to be certified. Do we have a shortage at the state level? It sounds like we may not at the county level, at least for minors, perhaps for adults, yes. Can you kind of just share a little bit of the landscape in terms of shortages, or do we have enough certified providers in the county?
In most counties, the answer is yes, we have enough providers. Again, there are some small counties that struggle, depending on how the size of the county. They sometimes can access providers from a neighboring county or a contiguous county. Here in Cuyahoga, we have a number of providers. I know we have at least 600 or 700 agency providers, and we have 1,000 independent providers. So many of our agencies might have 200 or 300 staff, serve 200 to 300 people. So there's plenty of providers here. However, that is something that was especially sort of at the crisis level during the COVID pandemic and immediately after. So last year in the state budget, county boards advocated for provider wage increases at the state level, and that was put into the budget. So on average, DSP wages went from somewhere around $11 an hour to closer to $18 to $19 an hour. And that has helped significantly with retention and attraction so that you no longer make the same amount of money at Target as you do caring for someone with a disability. And in Cuyahoga County, we continue to try to bring a pipeline of new providers in terms of high school students and individuals of that similar age that might be trying to figure out what they want to do for their lifetime. So we have a program that we've partnered with a place called DSPU, Direct Support Professional University, that we've run for several years where high school students get to come in, learn about the job, get some experience, and then get a credential that allows them to go and be hired by a provider organization. So we're continuing to do that. We've been talking to some folks at the Greater Cleveland Partnership about a potential apprenticeship program. So even though we're in good shape right now, we're always looking ahead for how do we continue this large system with people that are going to continue to need care for many years.
All right, my last question, I promise.
That's okay, bring them on.
Partnership opportunities. So, I know that there are workshops. I know there's employment programming. I know that there's some independent organizations that like to, partner or work with some of the folks in these particular populations. Is there a need for more partnerships in terms of, we'll say, employment or workshop opportunities? And in your opinion, how do we best meet those needs and kind of rise to that challenge?
So we partner with a number of organizations, as you indicated, and I would like to just clarify that all of the private providers that run the workshops or run the employment services programs, although they are the direct provider, again, we as a county board are funding all of those services. So we're funding the 40% even for those private providers. Here in Cuyahoga County, we have a way to measure how, when someone is looking for a provider, how long does it take them to find a provider of that service? So we can monitor when do we need to build more services or when do we need to go find new providers. And generally, we don't have trouble finding providers for day program and employment services. Where we tend to need to actively recruit providers is in the areas when perhaps someone needs providers that are ASL, American Sign Language proficient, or people that are bilingual. That's an area that over time we have also sort of encouraged providers to get into. We have created an organization called the Employment Collaborative of Cuyahoga County that actually serves as a connector between many different providers, allowing them to come together and work with us to share referrals and build business connections and find employment opportunities. So I don't have any needs off the top of my head where service areas aren't being met, but we do continue to talk about, especially children who are very young with significant behavioral needs. We've talked to your folks at HHS and DCFS quite a bit and partnered with them to make sure that providers are able and prepared to serve those children and hopefully serve them in the family home before they would potentially disrupt from that situation. So that's the area that we're continuing to focus on right now. You're welcome.
Thank you, Madam Chair. Thank you to my colleagues for some great questions. You're not leaving many left, but I do have a couple quick ones. As far as you mentioned a lot of demographics of people, and I thought you mentioned something about zip codes, through Chair, but I might have missed that. Did you say you do have the location, like where we serve? Is that's readily available?
Yeah, we definitely have the zip codes where people live that are getting DD services. It's not in the presentation just because it would be a really hard slide to look at, but I'd be glad to share that with you.
So that we can break it down by zip code or through district per
Yes,
se to
yeah.
see who's being served.
Absolutely.
Appreciate that. And, through the chair, one of the most concerning things to me about this presentation is you're looking at additional funding would be needed next 2 to 3 years. If we're on a scale like an alarm bell, where is it going off to you right now? Where are we at, 1 to 10? What's the emergency level?
Our current projections say that in 2028, we won't be able to pay all of our bills.
And
Pretty high for me.
yeah, thank you. Madam Chair, through the chair, I would like to say, what does that look like in the worst case scenario? We're running low on this funding. How do you determine, are people getting kicked off the program or are their benefits being decreased overall? What does that look like?
That's a great question. Without getting into too much specifics, in the waiver program, we're not able to decrease services because of funding issues. So the waiver program would probably not be the area that takes any reductions. It would be all of those other services that I mentioned previously. So for example, early intervention is a fantastic program. We see from data that it works. We know that on average, for every dollar you spend on a little kid who's 0 to 3 and give them interventions, you're gonna save $7 throughout their lifetime because they may never need you and your system again. So that's a service that is critical to our community, but is not funded. We don't receive any funding for that service. And so we would look at all of the programs like that and try to determine if specific programs themselves are eliminated or reduced in order for us to meet that waiver match obligation. And I want to just be clear, I don't want anyone to watch this and think Amber said we're getting rid of early intervention because it's critical, and I'm a huge supporter of our early intervention program.
No, thank you. Obviously, we want to do everything we can to keep you funded. So we're looking at, in 2025, 77% of the projected revenue. So you're looking, if we're running low and we can't reduce the waivers, we're looking at, we can near 100% on this. So the number could get that high, so we're losing a lot of these other services.
Yes.
You're strictly doing that, so. So we do have
We have some
brewing
conversations.
emergency
Yes,
on
yeah.
our hand here.
Yeah.
Okay. Well, I appreciate your candor, and thank you for your presentation today.
Thank you.
I had an additional question, Chair, just real quickly to the Chair, to the Director. Excellent question by Councilman Castleberry. We all can get, I'm extremely interested in the zip codes as well.
Oh, yeah,
So
I'll
you
send
just-
them to the chair and she can share them.
Thank you.
All right.
Yeah, I'm sorry. It's great for you to know you know, where the people are in Cuyahoga County. And one of the things that we've started doing over the last 2 years is we go to every city council meeting throughout Cuyahoga County, and we just reintroduce what we do, because many times your council person might be the first one to get a call when you have a concern. And so we want them to know we're there, and we actually share with them how many people we serve in their communities as well.
Just one question. How many individuals out of the 15,000 do not receive the Medicaid waivers? You said everybody does not receive.
We have about 50, almost 5,200 on the Medicaid waiver. So almost 10,000 do not need a waiver.
Any other questions from my colleagues? All right. Anything else you'd like to share?
Just, I really appreciate the opportunity. I would love to come back and talk anytime. I could talk about this for days, but we appreciate your partnership and your support. I know I've talked to several of you over time about different people that have reached out to you about concerns or questions or services. So we're here. We're driven and passionate about what we do, and I appreciate the opportunity.
Just one final question. So you mentioned earlier in your presentation that sometimes people appeal and they go to the state, and the state determines what's the outcome in that in the individual cases. How many times do you think people actually appeal? Oh. And what's the outcome? Is it half and half?
It's not very frequent that people appeal, because again, many times we're trying to meet their needs in a way that they don't need to feel like they're not getting a service. So 25% or less than 25% of the time they appeal. And the vast majority of appeals, we are successful in. I would say over 90%, we're usually found to be accurate in our decisions. Is that fair too? Okay.
Saying nothing, hearing nothing. Thank you very much for presenting this to us. It helped open up our eyes a little better understanding of your day-to-day work in terms of the waivers. I know this is important information for a lot of families out there. And it's not specifically just for autistic children. It's for everyone that, I guess, screens as developmentally.
Correct. We have hundreds of diagnoses that we serve. So yes, people with different diagnoses, I should say.
Okay,
Thank you so much.
thank you. All right, any miscellaneous business from any of my colleagues? Anything you'd like to share? All right, meeting is adjourned.